Currently, there is no known treatment for Ebola, then there's no vaccine. There are companies that are working pretty quickly on developing vaccines, and maybe they'll be in testing in the next year or so, but certainly nothing that will come up in the near future. And there are also companies that are working with antiviral drugs that seem to have some efficacy in vitro, but nothing that's been tested in people yet. So you may have heard about some investigational drugs that were tried on a patient in Dallas. It was one patient and it was one time. So there are investigational drugs that are out there, but certainly nothing that we would look at and say this is very promising and we have to get it right away. One of the other approaches that was tried with a nurse in Dallas was to get an infusion of plasma from one of the people that recovered from Ebola. And whether or not that works, we don't know whether that will make a difference and whether that will be something that will prove effective. But for now, there's no treatment and there's no vaccine.
And the theory behind the serum therapy or the ZMapp therapy?
Yeah, the theory is that you would be giving very high levels of immunoglobulin with antibodies directed specifically against that strain of Ebola. And ZMapp is synthetic immunoglobulin, and the blood transfusion would be antibodies that were developed by the person who recovered from infection.
Dr. Segreti, do you mind just commenting on not everyone dies who has Ebola, right? I think that's also very important to understand.
Yeah.
There is supportive care.
That's a great point. The mortality in Africa is about 70% right now. When there have been outbreaks of hemorrhagic-like fevers in more advanced countries, for example, Marburg in Germany, there was an outbreak in the 70s. With supportive care, mortality is probably closer to 20 to 30%, because a lot of times the reason people die is not just because of the virus, but also because of the electrolyte abnormalities. And one of the lessons learned from Emory, also the University of Nebraska, is that these people had very drastic changes in their potassium and their calcium, and the fluid shifts were enormous. And many of them, the people that were transferred from Africa, hadn't had a blood test in 2 weeks. So that's how people are taken care of in places that don't have the resources. So with support, you would expect that the mortality is still high. 20, 30% mortality is still very high, but we would expect that it would be lower here in the U.S. But still the best way to treat Ebola is to prevent it.
But I think the point that you're making is one of the questions you made is very important. Is earlier aggressive treatment potentially improve your outcomes? And I think that we would all agree it does. Providing supportive care and aggressive supportive care in a very highly protocolized way is what we're getting better at with every disease process in each case. And there's nothing in medicine where delaying the appropriate therapy improves your outcomes. So certainly staying up on those electrolytes, although it sounds easy, is a challenge, is the reason we built an isolated unit for these patients.